We're going to take testimony but not vote the merger bills.
Right.
And then we're going to take testimony.
The House Committee on Regulatory Reform will now come to order. Madam Clerk, will you please call the roll?
Here.
Representatives Liberati,
Here.
Neely,
Here.
Scott,
Present.
Young,
Here.
Grant,
Here.
McFall,
Here.
Snyder,
Here.
Wilson,
Here.
Mueller,
Here.
Filler,
Yes.
Wenzel,
Here.
Aragona,
Here.
Beerline,
Here.
Nyer.
Here.
Mr. Chair, you have 15 members present. You have a quorum.
Thank you, Madam Clerk. Representative Liberati moves to adopt the minutes from the December 3rd, 2024 meeting. Seeing no objections, the minutes are adopted. We will now take testimony and vote on House Bill 6010, Medical Director Recruitment and Loan Repayment, sponsored by Representative Fitzgerald, who is here to provide testimony. Rep. Fitzgerald, come on up.
Thank you, Chair Carter and members of the committee. Appreciate the opportunity to be here today to speak on House Bill 6010 that would allow the repayment of loan debt for Masters of Public Health degrees, MPHs, for the training of local health department medical directors. Medical directors employed by local health departments are essential to public health. Medical directors have an MD or a DO and subsequently are required to obtain a Masters of Public Health degree. Amending the Public Health Code to provide repayment of this public health graduate degree would support recruitment and retention of these essential health providers. Since March 2020, MDHHS has seen 16 changes in medical directors out of a total of 30 covering the 45 local health departments in Michigan, meaning several of them provide medical directorship for more than one local health department. Many of the departures were for retirements, and several are pending in the next few years. The ability to repay loan debt for the MPH degree would alleviate significant burdens and barriers for medical directors and LHDs and the LHDs they served. Additionally, it may result in the ability of LHDs to recruit more medical directors to underserved communities that have smaller coverage areas with deeper community engagement and support. Here's a brief summary. MDHHS proposes to amend MCL 333.2705(1) to allow repayment of loan debt for Masters of Public Health for the training of local health department medical directors. The department would administer an essential health provider repayment program for designated professionals who have incurred a debt or expenses as a result of a loan taken to attend a medical school, dental school, nursing program, public health graduate degrees, the training of a local health department medical director, certified nurse midwives, and the list goes on. But really what, in short, this does is it ensures that we have qualified persons who are not restricted by cost or financial burden to be attracted and then be retained into this critical job that we have here in the state of Michigan. And I have other experts here with me today to provide testimony that will provide a little bit further knowledge about why this is important for Michigan.
Thank you, Representative Fitzgerald. And to your speakers, can you make them brief? We have a packed house. We have a robust agenda today, and I want to give everybody the opportunity to speak. I know we will not get there, but I just want to give everybody an opportunity. So with that,
Thank you. Good morning. My name is Beth Nagel. I'm the Senior Deputy Director for Policy Planning and Operational Support at MDHHS. I have with me Laura De La Rimbellier, who is the Director of the Division of Local Public Health Services. I'd like to thank the Chair and this committee for the opportunity to discuss House Bill 6010. I'd also like to thank Representative Fitzgerald for introducing this bill. House Bill 6010 would allow for the recruitment and retention of local public health medical directors through offering medical education debt repayment in exchange for their service to our state. House Bill 6010 amends a program called the Michigan State Loan Repayment Program that focuses on the recruiting and retention of high-level medical professionals in underserved areas of the state by repaying up to $300,000 in medical education debt over 10 years of service. This program, which is sometimes referred to in statute as the Michigan Essential Health Provider Program, has been operating in Michigan since 1995 and has incentivized nearly 2,000 health providers to practice in high-need areas of our state. The providers currently served by this program include physicians, dentists, psychiatrists, nurse practitioners, physician's assistants, and clinical therapists specializing in primary care. The Michigan State Loan Repayment Program is one of the largest programs of its kind in the nation, and that success can be attributed to the strong support and investment by the legislature throughout its history. This bill would allow local public health departments to recruit and retain medical directors, as these positions are both required in statute and in significant demand throughout the state. Medical directors employed by local health departments are essential to Michigan's public health planning and response. Medical directors are medical doctors that have an MD or a DO and are then also required to obtain a Master's of Public Health or a Master's of Public Health in Science degree. Since these physicians need advanced training in public health, it is highly likely that they carry a large amount of medical education debt, and this makes loan repayment an excellent tool for recruitment and retention. The Michigan State Loan Repayment Program can administratively and financially serve this small, targeted pool of applicants without any disruption to the rest of the program. In consideration of this information, the Michigan Department of Health and Human Services supports this bill.
We're happy to take any questions.
Thank you. We have questions from Representative Wenzel. Oh, you good? Thank you. Representative Filler.
No question.
Thank you. Thank you for your testimony. Oh, did we have any? Sure? Okay. Thank you. In support of the bill, wishing to speak, Norm Hess. All right, they gave you an extra 30 seconds. 2 minutes. No, thanks.
Thank you, Chair Carter, members of the committee. My name is Norm Hess, and I represent the Michigan Association for Local Public Health, which is the statewide professional membership association of all 45 city, county, and multi-county district health departments in Michigan. You have a copy of my written remarks. I will not reiterate much of what has already been said, but I would like to just say two things. One is, physicians go through a lot of training. They are generally trained to treat an individual patient and their families. If you talk to any of our medical directors, they will tell you that switching to taking care of the health of an entire community is a big leap. It's not something that they've been trained to do, and so a Master of Public Health degree is really important for them. Imagine yourself as a local health officer trying to recruit a medical director and say, thank you for spending the last 36 years in school. We would need you to get an MPH, and by the way, we're going to need you to pay for it yourself. So this would eliminate one more barrier to the challenges that the public health workforce is facing in Michigan, and so we would ask you for your support of House Bill 6010.
Thank you for your written testimony and your brief summation. Any questions from colleagues? No? Thank you. I will take a motion from Representative Neeley to report and vote to report House Bill 610 with recommendations. Madam Clerk, will you call the vote?
Chair Carter?
Yes.
Representatives Liberati?
Yes.
Neely?
Yes.
Scott?
Yes.
Young?
Yes.
Brandt?
Yes.
McFall?
Yes.
Snyder?
Yes.
Wilson?
Yes.
Mueller?
Pass.
Filler?
No.
Wenzel?
No.
Aragona?
Pass.
Beerline?
No.
Nyer.
Pass.
Secretary of 9 yeas, 3 nays, and 3 passes. House Bill 6010 is reported with recommendation.
Thank you, Madam Clerk. Next, we'll take testimony and vote on House Bill 5403, cosmetology secondary location, sponsored by Representative Neeley. We do have a sub for the bill, and Rep. Neeley is here to give an overview.
Good morning, Mr. Chair and members of the committee. I'm here today to speak on House Bill 5403 and its substitute. This bill allows those licensed to run cosmetology school to expand their school with granting a secondary school facility license. This will allow the creation of school branches in different locations without the stress of multiple new or independent businesses. This bill will encourage an expansion of cosmetology school and will help promote further business growth within Michigan community without adding stress to another business formation. With this ability to create more than one school under this secondary license, help increase cosmetology school and accessibility. The substitute before you today lays out the specific requirements needed for the expansion of that secondary school and requirement needs to ensure granting of this specific license. Overall, this bill will help ease administrative slowdowns and will make it easier to expand multiple locations. I thank you for your time today, and I will take any questions.
Thank you, Representative Neeley, and good to see that you're doing well today. Any questions from colleagues? Thank you. In support of the bill, not wishing to speak, but if needed, Paige Foltz from Laura. In support of the bill, if needed, Don Romaine from Douglas J. and Michigan Association of Beauty Professionals. Wishing to speak in support of the bill, David D-A-G-E-N-A-I-A. It's your handwriting, David. Want to speak? No? Okay. Seeing no questions. In support of the bill, Stacy Wells, not wishing to speak, from L'Esprit Academy. And not wishing to speak in support of the bill, Michigan Association of Beauty Professionals. With that, I will now take a motion to adopt the H1 substitute for House Bill 5403 from Representative Scott. Rep. Neeley moves to adopt the H1 substitute. Madam Clerk, call the vote.
Chair Carter,
Yes.
Representatives Liberati,
Yes.
Neeley,
Yes.
Scott,
Yes.
Young,
Yes.
Grant,
Yes.
McFall,
Yes.
Snyder,
Yes.
Wilson,
Yes.
Mueller,
Yes.
Filler,
Pass.
Wenzel,
Yes.
Aragona,
Yes.
Beerline,
Yes.
and Nyer.
Yes.
Secretary of 14 yeas, 0 nays, 1 pass. Substitute H1 is adopted.
Thank you, Madam Clerk. I will now take a motion from Representative Young to report House Bill 5403 with recommendations as substitute 1. Madam Clerk, will you call the vote?
Chair Carter,
Yes.
Representatives Liberati,
Yes.
Neeley,
Yes.
Scott,
Yes.
Young,
Yes.
Grant,
Yes.
McFall,
Yes.
Snyder,
Yes.
Wilson, Mueller,
Pass.
Filler,
Pass.
Wenzel,
Pass.
Aragona,
Yes.
Beerline,
Yes.
Nyer.
Yes.
Secretary of 11 yeas, 0 nays, 4 passes. House Bill 5403 is reported with recommendation as substitute H1.
Thank you, Madam Clerk. Next, we'll have testimony on House Bills 5884 and 5885, cannabis merger bills, sponsored by Representative Wilson and Filler. Do I need to time you all as well? Especially you.
Thanks, Chair.
Thank you, Mr. Chair. House Bill 5884 and House Bill 5885 work together to bring the medical and recreational market into one streamlined licensing and regulation process under the CRA. House Bill 5884 consists of the merged MRTMA, which was passed by a citizen initiative in 2018, and elements of the MMFLA, which was passed by the legislature in 2016, that need to be retained. We have heavily focused on ensuring patients and primary caregivers will be protected while participating in licensed facility activities. This is important as we do have qualified patients who are 18 to 20 and need explicit protections to participate in the license market as that is written for 21 and up, and MMA does not provide that. We have ensured that patients will not be charged the excess 10% tax. We have maintained all the tax breakdowns from the excess 10% tax for recreational retail sales, which includes the schools, roads, opted-in counties, and municipalities. We have created a new section, which is Section 6, and it is effective date March 2026, where all medical provisioning centers would become recreational facilities. But recognizing that not every medical community is ready to jump in with recreational use, we created an option for a new ordinance to be passed at the municipal level to opt out of the transition to recreational. We have adjusted the discrepancy between plant counts within MMFLA and the MRTMA. We do not want licensees to accidentally be over plant count due to a lesser amount when the transition happens. Class A will be 500 plants, Class B will be 1,000 plants, Class C will be 2,000 plants. This will ensure no one is unintentionally out of compliance when the transition takes effect. Through our committee sub that you'll eventually see later in the week, hopefully, we addressed needed patient and primary caregiver protection language added in, adjusted the inspection language to allow CRA to be effective in inspecting, regulating, and holding bad actors accountable. We have clarified that marijuana-infused products, commonly referred to as edibles, must be in opaque, child-proof bag. We added a new additional Section C to ensure that any and all marijuana products purchased and taken from a licensed facility must be in an opaque bag as well. We have removed the marijuana grow cap and micro-business grow cap, as the CRA and the rules have done the same internally, and this has been asked for from all stakeholders. We removed the definition of seed and seedling as they were unnecessary based on federal rulings. Seeds do not have THC in it. We adjusted the age, this is an important one for certain committee members. We adjusted the age from 18 for employment in the industry back to 21. We also fixed the lack of edible flower equivalency in the MRTMA. We addressed the revolving door issue, allowing for industry and individuals to work in the CRA. And we adjusted the other side, that unless they had compliance and enforcement direction at the CRA, they are not subject to the 2-year cooling off period for employment in the industry. That's my surmise of our bill package. I'm going to turn it over to the other bill sponsor, Representative Graham Filler.
And I'll be quick, Chair. You may be aware, committee members, that there's been an attempt, for a reason, to merge the two acts in the last 6 years, and every time it's gone badly. And when I watched it happen, it went badly because essentially people, stakeholders, whoever else, tried to Christmas tree the merger and put what would benefit their industry or what would benefit their client in there. And Representative Wilson and Senator Irwin and Robin from MICIA and many other stakeholders wanted to do instead is just a clean merge and just to have one act in the state of Michigan, cut down on the bureaucracy, allow caregivers to do well, allow this to be an industry that you want to invest in the state of Michigan because we're regulated and because we have rules and laws that make sense. So that's sort of our goal, which was to bring a Republican and a Democrat together and say this is nonpartisan, bipartisan. This is just going to lead to less bureaucracy, less burden on the people in the cannabis industry. And so thank you, Chair, for allowing us to come forward and talk about this. And it is a rather large bill, but I just want to tell you there's been about a year of work, very intense work on it. Robin, did you want to share some too?
I'll be brief as well. Chairman Carter, committee members, thank you for allowing this time. I'm Robin Schneider, the Executive Director of the Michigan Cannabis Industry Association. We represent over 400 legal business members. I'm here to express our strong support for this important and long overdue package of legislation. The bills before you will streamline licensing and operations for our members, saving them time, reducing licensing fees, and saving them the expense of burdensome, redundant regulations for both medical and rec. Additionally, this effort will streamline the operations for our regulatory agency, creating government efficiency and reducing government spending. More importantly, this legislation will put medical patients first by allowing them to access all products using their medical cards rather than just accessing what is a very dwindling supply of medical marijuana in our market. I want to add how grateful I am to Representatives Filler and Wilson and their offices who have spent significant time over the last full year work grouping this package in one of the most inclusive ways that I've witnessed. They successfully brought together both the business community, patient community, and activist community to work together, which is not always easy to do, but they did really well, and included the help of multiple cannabis specialty attorneys who graciously volunteered their time to make sure that we got this language right. As somebody who spent, 6 years of my life working on the MMFLA, it took us 3 full sessions to get that done, 6 years. We died in 2 lame ducks. And as the finance director for MRTMA, worked on that campaign. It was a 2-year campaign. I want to say that I am very comfortable with the work that we've done on this, and I'm really hopeful that we can get this common sense legislation done before the end of session. And so I just respectfully ask committee members to consider voting yes. Happy to answer any questions. Thank you for your time.
Thank you for your testimony. Any questions from committee members? Seeing no questions, thank you. I do understand that there is a sub that is forthcoming, correct? That will address the things that we've talked about. Thank you. So with that, not wishing to speak in opposition of the bill is Matt Sexton from the Michigan Sheriff's Association. Next, we will now take testimony on House Bills 4757 and 4758, Liquor Control Code, introduced by Representatives Steckloff and Filler, who are here to give testimony.
Good morning. Thank you, Chair Carter, Minority Vice Chair Mueller, and the committee for having us today. I know you've got a packed agenda, so I'm going to keep the welcome very brief. House Bill 4757 goes hand in glove with Rep. Filler's bill. Together, they amend the Michigan Liquor Control Code to increase the amount that on-premise licenses can deduct from the price of alcohol liquor brought from the state and prohibit the MLCC from considering a qualified violation older than 2 years when making decisions regarding changing the status of a license. Our commission has not been increased in decades, and small neighborhood retailers are forced to sell at a higher price point just to stay in business. These are the same small mom and pop shops that are trying to outlast the outside competition from big box retailers who can move more volume and sell at a minimum price to maintain profitability. This bill would align Michigan with most other states and would support local businesses who are struggling because of the rate of inflation, cost of goods, wages, utilities, and more. Again, I know we're short on time, so I'm going to be handing it off to Martin Manna.
Thank you, Representative Steckloff and Mr. Chairman, members of the esteemed committee. Thank you for allowing us this opportunity. I have with me today Mr. Joe Shalal, who is an attorney who's been practicing in this industry, the liquor industry, for quite some time, and also a founding member of our organization, and Mr. Salam Bakal, who is a retailer, along with several other retailers that are also here. The Chaldean American Chamber of Commerce has more than 1,000 members, some 5,000 locations. 35% of our membership are non-Chaldean. We have 200 corporate members, and we represent small and big businesses. But many of the people that we're advocating for today are small business owners. They're the small neighborhood stores that many people are familiar with. They're family-owned. And the last time the Michigan liquor retailers saw an increase in their profit margin was in 1982. Since then, their margins have remained the same despite inflation, rising operational costs over the several decades. There's many reasons why we hope you will consider supporting this bill, including improved profitability for small businesses. Many liquor retailers will operate again as small family-owned businesses. Increasing profit margins can help them stay financially stable, reinvest in their operations, and compete against the larger chain stores. It also will encourage job growth. With higher profit margins, liquor retailers may have more resources to hire additional staffs in their neighborhoods, offering job opportunities and strengthening the local economy. It'll also address inflation and rising costs. They have faced rising costs for inflation, labor, utilities, and other operational expenses. Increased profit margins can offset these expenses and help them maintain their operations. The last 3 years, as many of you know, has brought over 20% inflation along with rising wages. With the minimum wage set to increase, liquor retailers will continue to see their margins shrink. It'll also modernize outdated policies. The liquor laws are outdated remnants really of the Prohibition era, and so are the current profit margins that are tied to retailers. It'll also support consumer choice so they could stock a broad range of products, and then it'll provide fair compensation for retailers. Their margins are disproportionately low compared to the risk and responsibilities involved in selling regulated products like alcohol. At the end of the day, the state's making about a 65% margin on alcohol, while these retailers are making 17%. Most of them cost at least 25% just to operate their business. We look forward to hopefully hearing or seeing a vote on this important issue, and I'll turn it over now to Mr. Joe Shalal.
I'm here mainly to answer questions should the committee need to. What's that?
Push the red button.
Sorry. I'm here to answer questions should the committee have questions. I do have.
Oh, Joe Shalal.
I'm sorry, Joe Shalal. Thank you. I thought Martin introduced me. That's why I didn't say anything. So with it, in regards to, you may hear things with regards to, what's this going to cost the consumer. Our own Michigan Department of Health and Human Services published a statement from 2018 that says that the average additional cost for alcohol per adult per year, not per visit, per year, as a result of only a 5% increase, and we're asking for a little bit more than 5%, is for people that are moderate drinkers, it would be $3.43 per year. And people that are excessive drinkers, it would cost them $19.22 per year. You're hearing all kinds of numbers. I don't know why we should go against our own organizations in the state of Michigan, the Michigan Department of Health and Human Services, when they're telling us this is what it would cost per year for these types of consumers. If you have any questions, I'll be happy to answer them.
Thank you. Did you want to add anything? Introduce yourself, please.
Hello. My name is Sam Bakal. I own a business in Madison Heights for the past 39 years. And as Martin stated earlier, most of us are family-owned, small independents. We face many challenges as the time goes on, and he addressed a lot of them as far as labor, credit card processing, credit card usage. 10 years ago, credit card usage was no more than 33% usage. Now it's probably 90%. So all these things do add cost. At the end of the day, we end up working more hours because we cannot hire as many people as we need in an operation like this. 17% just doesn't cut it anymore. A lot of businesses are struggling or selling out or closing down. So this is a real challenge that we are facing.
Thank you. Any questions from committee members? Yes. Aragona?
Thank you, Mr. Chair, and thanks, guys, for being here. So We've thrown around a couple of like percentages, and you guys mentioned 17%. Can you guys just go back to the basics real quick? From my understanding, liquor goes through the state. There's a markup to state minimum, and then you said 17%. If I'm not mistaken, you guys are buying on a 17% discount, and in the bill you're increasing that discount, right? Can you just go into depth just a little bit on that, just so everybody understands?
Well, I mean, the question is broad, so, I mean, basically, we're asking the commission, so the commission has a range of what they can discount, okay? And right now, I think it's from 25 to 38% or something like that. And so as a result, we're asking the commission to allow our discount, which is 17%, to be increased to 25%. 23. Is it 23 now? 23%.
So just to be clear, in the bill right now, if you read the bill, it's at 35%. We've discussed amendments for 23, correct?
Correct.
Okay.
Yeah, we worked that down to 23%. It costs these retailers, I represent hundreds, if not 1,000 retailers in the state of Michigan in my practice, and it costs literally these retailers 25% just to put their key in the door. To put their basic overhead that you cannot adjust, water, gas, electric, rent, it's 25%. And we've been working with 17% for almost 40 or almost 50 years. And it's preventing these business owners from enlarging the scope of their businesses, improving their businesses, and by improving their businesses, improving the communities around them. So, yes, the discount to the liquor control that the Liquor Control Commission is allowing us to take is only 17%. And just so you understand, it's a 17% markup. It's really only a 15% profit margin. So they make 15 cents on a dollar. So we're basically asking the commission to allow us to take a higher discount.
Yeah, okay. So if I walk into a liquor store, I buy a bottle of Jack Daniels for, let's say it's $40, and that's state minimum. You guys are purchasing that for 17% below that, and that 17% is basically what the commission is saying, this is what you get to make.
Yes.
Okay. Okay.
That's exactly what it is.
Okay. Thank you.
Thank you for your testimony. Do we have a Jerry Griffin wishing to speak? Yeah, you guys.
Good morning, Mr. Chair, members.
Morning.
My name is Jerry Griffin. I'm the VP of Government Affairs for the Midwest Independent Retailers Association. We are an organization that represents small family-owned businesses like my colleagues at the Herb Chamber, involved in the food, beverage, petroleum industry, amongst a variety of things throughout the Midwest. And I do know that we are dealing with a kind of a moving target here, so I just want to make sure that my testimony is clear as to where we're at. As far as the bill was introduced, conceptually, we absolutely support the idea. And I want to thank Representative Steckloff for getting this conversation started. It is absolutely true that the discount that small independent retailers or any liquor vendor gets has not moved in quite some period of time. And we would absolutely support the idea of moving that number. The state, if any of you have reviewed Liquor Control Commission financials, the state does very well in terms of the liquor industry, and we would like to see that revenue shared a little bit more with our members in particular. In competition with the large box retailers, they can absorb increases or anything in terms of the cost structure much better than our members can. So we would hope that as this conversation continues, that there is even a recognition perhaps of finding a way to help the small independent retailers with on a discount and a broader scale. I do think at this point in time, I mean, this is legislation that MIRA has helped introduce in the past and actually has introduced in the past. It was certainly not at the level that's proposed in the introduced version. That's why I say conceptually we supported it, because at that level, it would be very difficult to maintain the Liquor Control Commissions. I mean, it's possible that LCC would be dissolved. And that's important that it maintain, for us, it maintains a competitive balance, at least as much as possible in our current situation, that the MLCC structure and the three-tiered system helps us, as much as possible, maintain some sort of competitive balance with the large box retailers. We would like to see that improved somewhat a little bit, but we do know there is some introduced or some substitutes that are being considered. At this point in time, we would absolutely, if we would look at a figure that is a little bit smaller, we think that's more realistic, but it absolutely cannot include, from our mind, we would like to see any amendment added to that would eliminate the language that would allow the state to increase their markup. Any increase in that would basically defeat the purpose of increasing the discount. So at this point in time, we're hopeful that any amendments that are made would strictly involve increasing the liquor discount to retailers and strike any language that addresses any potential increase in the state markup. I think this can be done with a modest increase in the discount, where the state would be sharing some of the profits that they are currently enjoying from the sales of liquor with our members. So with that, I'd be happy to answer any questions anyone has.
Thank you for your testimony. Any questions other than Aragona? Representative Aragona.
Thank you, Mr. Chair. And Jerry, thank you for being here to testify on this. So, I think Rep. Steckloff did some great work on these bills. You're saying going from that 17% discount to 35, so you're going to make more money when you're purchasing and still selling at the same state minimum, so consumers are held harmless. You're saying that might be a little high. But somewhere in there is that magic number that everybody probably should be happy with. Am I putting words in your mouth, or do you think that's accurate?
Well, no, but I would simply put it this way. If we were to take the discount to that level and keep the state markup from not moving any more than it can, because they are at their maximum right now under the regs at 65%. That money's got to come from.
That part. I'm just getting into your discount.
That money's got to come from someplace.
Yeah.
And we would have a fear that would mean the dissolution of the Michigan Liquor Control Commission. And that three-tier system really helps us maintain some level of competitive balance with the big box retailers. That goes away, and we may be sorry.
Sorry, I don't mean to cut you off.
Yeah.
I know that the chairman wants to get to other bills and we want to
Sure.
get this going. But real quick, you mentioned the 65%. So can you clarify that? I believe that's the state is bringing in bottles. Technically, the state is the one selling to liquor stores. They mark up to 65%.
They mark up a wholesale price, and they are
becomes
allowed
state
to go
minimum?
up to 65%. And currently, that is the markup. I mean, certainly we've got reps from liquor control here that can clarify anything different from what I've said about their role and what they're doing, but that is what's allowed right now, and they're marking it up at 65%.
And you would not be in favor of going above that?
Well, it would kind of defeat the purpose of the bill if there was an increase in our discount, but also an increase in the markup.
Okay, cool. Thank you.
Thank you for your testimony.
Thank you.
Not wishing to speak in support of the bill, Mason DeBoer, Scott Ellis, MLBA. Not wishing to speak in support of the bill, Brandon Youssef, Clausen Gas Station. Not wishing to speak in support of the bill, Sam, 3 Wiseman. Not wishing to speak in support of the bill, Yusuf Yaqub, Sterling Heights Shell. Not wishing to speak in support of the bill, Rudy, gotta get some better handwriting, Rudy, from DTH Gas Station. Not wishing to speak in support of the bill, Jason Hanna from JSD Enterprise. Not wishing to speak in support of the bill, Luai Yusuf, Wayne Express, Inc. Not wishing to speak in support of the bill, Tenon Greenfield Gas Station. Not wishing to speak in support of the bill, Kenny Questro from Troy Gas Station. Not wishing to speak, neutral, Andy Deloney, Distilled Spirits Council of the U.S. Not wishing to speak in support of the bill, Leah Robinson, Michigan Chamber. Not wishing to speak in support of the bill, John Kizzy, Lincoln Park Palace. Not wishing to speak in support, Sharkey Haddad, Wine Basket Market. Not wishing to speak in support of the bill, Talal Muhtar from Sylvan Convenience, Inc. Not wishing to speak in support, Arthur Kanja from the Vreeland Market. Not wishing to speak in support of the bill, Jeremy Griffin, Midwest Independent Retailers. Not wishing to speak opposing the bill, Reverend Bill Armudston from Michigan Council of Alcohol Problems. Not wishing to speak opposing the bill, Mike Tobias, Michigan Alcohol Policy Promoting Health and Safety. Not wishing to speak in support of the bill, Amy Demeaux from Michigan Retailers. Not wishing to speak in support of the bill, Jacob Manning from SBAM. I have a card from David Martin from Michigan Liquor Control Commission opposing the bill. If you would like to speak, I can give you 2 minutes. If not,
Thank you, Mr. Chair. We hadn't planned on speaking, but if there's any questions that the committee has, I can try to explain those. We are opposed mainly because of the general fund reduction in the profits that would be going to the legislature to appropriate. As proposed, the bill would cost in the 300 to 40 million range in general fund profits that we give back to the commission, or from the commission to the legislature every year. I think at the 22%, it's around 93 million back of the envelope calculations that would be reduced in the profits that come from the sale of liquor.
okay. We have any questions for Mr. Martin? Yes, Aragona.
Thank you, Chair Carter. Thank you, sir, for being here. How much money does it take to run the Liquor Control Commission every year?
I don't know the exact, is that our business director? It's in the, I want to say 16 to 18 million range.
So it's safe to say that we are well in surplus with the fees that are being put on this highly regulated product.
I wouldn't necessarily categorize it that way because it's not money that the Michigan Liquor Control Commission is keeping. It's money that's general fund that's going back, that we don't collect that money for us to use it. It's money that we have to spend back. So yes, it well more than covers our expenses.
Okay, thank you.
Hi, good morning. I'm Carrie Crone. I'm the business manager for MLCC. So as David indicated, the funds that we are talking about as far as that price tag or cost factor for this proposed concept would directly come out of the profits that we contribute to the state, to the legislature, et cetera. Our funding is sourced from a couple different areas at MLCC as a whole. We are partially funded from our fees that we bring in for our application processes, our permits, and those kinds of things. And then we are also internally funded by a small percentage portion of our liquor sale revenue. So our actual operation costs is split between those two areas. And then the additional percentage that comes in from the liquor sales goes into this kind of profit area or contribution that we contribute to the state. So what we're talking about, and I think previous speakers mentioned, is at the introduced version percentage increase, it would pretty much wipe out or even could almost deficit the amount that we contribute every year.
Okay, thank you. So
Does that
it would
help?
Yeah, it would reduce the amount going into the general fund. I just want to make sure. I mean, Carrie, you and I have talked on the phone about a variety of different issues. You know, maybe even with some of the guys in here. I'm not even sure, but you know, you guys have always done a great job, and I just want to make sure that you guys were held harmless with whatever percentage if we decide to move forward on this. So
Yes.
I just wanted to see where that threshold was. But
I mean, technically it could get to a point if it was so high that it might affect us.
Yeah.
But you know, maybe as introduced it could, but predominantly it's just in that amount that we contribute because the percentage we're able to use for our operational needs out of the liquor sales is a smaller percentage. We don't get to use 100% of it. I would love to be able to do that. If you'd like to consider that, we could have another conversation and another meeting on that one.
Thank you, Mr. Chair.
Thank you, and thank you for your testimony. Right now, I'm going to entertain a proposed amendment from Representative Argona. Would you like to speak to your amendment?
Yeah, thank you, Mr. Chair. And thank you, colleagues, for just taking a quick look at this. So, in short, like I had said before, Representative Steckloff has done a great job on this. I know Rep. Filler has done work on this as well. But in talking with a lot of the interested parties and people this will affect, and especially with Treasury, 35% seem to be a pretty high percentage of a discount to give to the liquor stores, and that monies would be coming from Treasury. So my thought was, if we can lower it down to the 23%, back of the napkin math, we're talking some tens of millions, not all the way up to 100 million that it would take out of the budget. But I think this would be at least amenable to. If I'm not mistaken, it's going to be good with all parties involved. Treasury, it's going to at least have a far less hit than the bill is introduced. So I thought this was a good middle ground for everybody instead of having a 35% discount. Again, that's from state minimum. The liquor stores get to buy at 35%. Currently, they're buying at 17%. The bill is introduced, they would get to buy at 35%. My amendment simply says instead of 35%, they're going to buy at 23%. So they're still going to get a larger margin and be able to make more money. It just won't be quite as much money as what the bill was introduced at. So thank you, Mr. Chair.
Thank you, Representative Aragona. Representative Mueller makes the recommendation to vote on the amendment. Madam Clerk, would you call the roll?
Chair Carter?
Yes.
Representatives Liberati?
Yes.
Neely?
Yes.
Scott?
Yes.
Young?
Yes.
Grant?
Yes.
McFall?
Yes.
Snyder?
Yes.
Wilson?
Yes.
Mueller?
Yes.
Filler? Wenzel?
Yes.
Aragona?
Yes.
Beerline?
Yes.
Nyer.
Yes.
Mr. Chair, you have 14 yeas, 0 nays, 0 passes. The amendment passes.
Thank you, Madam Clerk. We will now take up testimony and vote on House Bills 6198 and 6199, Animal Care Facility Licensing, sponsored by Rep. Skaggs, who is here to give an overview. Okay.
Thank you, Chair Carter. Members of the committee. Good morning. Thank you for the opportunity to testify today on House Bills 6198 and 6199. This legislation represents a critical step forward in achieving a comprehensive and consistent oversight of animal care, shelters, breeding facilities, and commercial pet shops. Working in collaboration with MDARD, with this legislation, we hope to create a regulatory framework that benefits animals, facilities, and the Michigan residents that wish to love these animals. So what's the problem? Currently, and this testimony that I have before you puts it in very fancy terms, but the regulatory oversight of animal care facilities lacks the comprehensive mandates necessary to ensure consistent operational standards in these pet facilities. That's fancy language for what we are dealing with, which is a largely unregulated marketplace for animals. Since the department was forced to suspend the licensing of pet shops in 2009, inspections have been limited to animal shelters, large breeding facilities, based only on reportable disease crises investigations. So again, we are largely unregulating the breeding and sale or adoption of these animals. This limited scope has left critical gaps in oversight, leading to a patchwork of practices and varying levels of animal care that has raised concerns about the welfare of animals and the accountability of these facilities entrusted with their care. So the goal of this legislation is to protect puppies, kitties, and ferrets. It does so by defining clear categories for pet facilities and outlining the extent of MDARD's involvement in licensing inspections. It requires the department to promulgate rules in consultation with stakeholders to license, regulate, and then inspect pet facilities. It requires facilities to adhere to standardized guidelines for operations and animal care and ensure that all unhomed animals within MDARD's jurisdiction receive humane treatment. The current system is failing us. It leads to the overbreeding of these animals, inhumane conditions, sometimes animals spending their entire lives in cages, and unhealthy conditions. So this bill is working to, again, protect the animals that Michiganders care about. Thank you for your time and consideration. With the chair's approval, I will turn it over to Michaela Heffernan with MDARD, who will go over some more details on the legislation.
How much detail do you have?
Very quick.
All right, thank you.
I am also on a timeline. Joining us on Zoom for the next 5 minutes, we have Dr. Nora Wineland, the state veterinarian, to answer any of the more technical questions. As Rep. Skaggs alluded to, House Bill 6198 clarifies and establishes minimum standards for animal control shelters, animal protection shelters, dog breeding kennels, pet shops. We would require annual inspection and licensure for all covered entities. It would amend the definition of animal protection shelter to now include and require minimum standards for animal sanctuaries and rescue facilities, including those that are either foster-based or utilize foster placement. For-profit animal protection shelters are also now required to be licensed under this bill. To better protect Michigan's pets, all entities covered by this bill are required to have an emergency and contingency plan for the care of their animals in the event of an emergency or disaster. I would like to point out that the changes outlined in this bill wouldn't take effect until January 1st, 2027. Industry stakeholders will have the opportunity to weigh in on more detailed requirements during the rule promulgation process. Overall, the changes in this bill are intended to revamp the way Michigan looks at pet stores, shelters, rescues, and fosters to better protect the animals that rely on us. We are looking to hold Michigan's animal industry to higher standards and ensure clarity in the way MDARD works with Michigan's pet stakeholders. We're not looking to punish the people in the system that are doing good, but we are looking to avoid dangerous situations caused by critical gaps in our regulatory framework. At the chair's discretion, myself and Dr. Wineland are happy to answer any questions you may have.
Thank you. I think we have a question from Representative Snyder.
Good morning, and thank you. It's relatively apparent this morning that we have more concern over this than over animal or booze than we do over the dog breeding, which I think for the next 2 weeks I might fall in that same camp. But could you please specify the differences in the bill between small scale and large scale?
Absolutely. So currently, anybody that has 15 or more breeding females is considered a large-scale dog breeder. Those are currently inspected by the USDA and by MDARD. In this bill, we've added a new section for those that have between 5 and 14 breeding females. They would be considered small-scale dog breeders and would be required to be licensed and inspected under this bill.
Thank you.
Representative McFall.
Thank you, Chair. So we received a letter from the Humane Society that is adamantly against this. Have you worked with the Humane Society? Because they feel that this bill doesn't really do what you're wanting to do. I'm all in support of regulating these, but they feel like that this is kind of just window dressing is what I kind of get from their letter. Can you address that?
I have have not heard any concerns from the Humane Society, but I am perfectly happy to chat with them, and my hope is that there's some here today that can find me after committee.
So you haven't worked with the Humane Society at all regarding this bill?
Not directly. This bill was primarily established using information from other states, some conversations with stakeholders over the past couple of years, but nothing most recent.
Okay, thank you.
If I may, Chair, I'd also like to answer that, Rep. McFall. I have had a few conversations with the Humane Society, both the local Michigan chapter and the national organization, as we worked forward on the broad outlines of this bill. Had discussions with them as recently as last night. I look forward to hearing some more of their suggestions on ways that we can improve the bill as we move forward. And I'm certainly more than willing to do that as we look for possible improvements on the floor.
Representative Young.
Thank you, Representative. Thank you both for being here. I'm just curious, back to this letter from the Humane Society, and they actually do uplift a piece of legislation that they think could solve the same problem. So I'm just wondering, perhaps you could work with that bill sponsor to see if we can come to some agreement so we're all on the same page, supporting the same things, and not necessarily working against each other, but coming at it the same way to achieve the same type of outcome.
Representative Bierland.
Thank you, Mr. Chair. Do you know how many positions this would create in MDARD to oversee the program?
We are looking at approximately 6 positions.
Okay, and do you have a total cost? I didn't see the fiscal analysis, I'm sorry.
As far as the positions, I don't have an FTE cost, but 6 FTEs with an approximate max of, I believe, $100,000 to ensure that all of our technology is up to date and we have the database functioning.
And would the licensing fees be able to cover the full amount that would be needed to oversee the program?
No, it would not. We intentionally kept the licensing fees low as to not cause additional hardship on these folks that are trying to do well.
Okay, thank you very much.
All right, seeing no other questions, thank you for your testimony. Not wishing to speak, neutral, Rusty Merchant, the family puppy. Not wishing to speak, opposing the bill, UP Beer Hodgsman. Not wishing to speak, opposing the bill, Mike Thurman, Michigan Hunting Dog. Not wishing to speak, opposing the bill, Pear Breed Dog Breeder, Mike Thornton. Not wishing to speak, opposing the bill, Michigan Bear Hunters Association. Not wishing to speak, neutral, Elizabeth Koonsman, Petland. Not wishing to speak, opposing the bill, Tanya Hildenforth, Humane Society of Huron Valley. Not wishing to speak, opposing the bill, Sarah Devaney, Michigan Pet Alliance. Next, we will now vote out Senate Bills 730, 731, and 732, which we heard testimony on December 3rd. Are there any questions from members? Got cards? On 730, not wishing to speak in support of the bill, Michael Tobias from the Michigan Alcohol Policy Promoting. Not wishing to speak in support of the bill, Lou Gretsch Cumbo, Great Lakes Wine and Spirits. Not wishing to speak in support of the bill, Brett Visner, Michigan Beer and Wine Wholesalers. I will now take a motion from Representative McFall to report Senate Bill 730 with recommendations. Madam Clerk, will you call the vote?
Chair Carter?
Yes.
Representatives Liberati?
Yes.
Neeley?
Yes.
Scott?
Yes.
Young?
Yes.
Grant? McFall?
Yes.
Snyder?
Yes.
Wilson?
Yes.
Mueller?
Pass.
Filler?
Yes.
Wenzel?
Yes.
Aragona?
I'm
Oh, sorry. Beerline?
Yes.
And Nyer.
Yes.
Mr. Chair, you have 12 yeas, 0 nays, 2 passes. Senate Bill 730 is reported with recommendation.
Thank you, Madam Clerk. I will now take a motion from Representative Wilson to report Senate Bill 731 with recommendation. Madam Clerk, will you please call the vote?
Chair Carter?
Yes.
Representatives Liberati?
Yes.
Neeley?
Yes.
Scott?
Yes.
Young?
Yes.
Grant?
Yes.
McFall?
Yes.
Snyder?
Yes.
Wilson?
Yes.
Mueller?
Pass.
Filler?
Yes.
Wenzel?
Yes.
Aragona? Beerline?
Yes.
Nyer.
Yes.
Mr. Chair, you have 12 yeas, 0 nays, 2 passes. Senate Bill 731 is reported with recommendation.
Thank you, Madam Clerk. I'll now take a motion from Representative Snyder to report Senate Bill 732 with recommendation. Madam Clerk, will you please call the vote?
Chair Carter?
Yes.
Representatives Liberati?
Yes.
Neeley?
Yes.
Scott?
Yes.
Young?
Yes.
Grant?
Yes.
McFall?
Yes.
Snyder?
Yes.
Wilson?
Yes.
Mueller?
Pass.
Filler?
Yes.
Wenzel?
Yes.
Aragona? Beerline?
Pass.
Nyer.
Yes.
Mr. Chair, you have 11 yeas, 0 nays, 3 passes. Senate Bill 732 is reported with recommendation.
Thank you, Madam Clerk. We will now vote out Senate Bill 867, which we heard testimony on last week. Are there any questions from members? We don't have any cards on that one. I will take a motion from Representative Liberati to report Senate Bill 867 out with recommendation. Madam Clerk, will you please call the vote?
Chair Carter?
Yes.
Representatives Liberati?
Yes.
Neeley?
Yes.
Scott?
Yes.
Young?
Yes.
Grant?
Yes.
McFall?
Yes.
Snyder?
Yes.
Wilson?
Yes.
Mueller?
Yes.
Filler?
Yes.
Wenzel?
Yes.
Aragona? Beerline?
Yes.
Nyer.
Yes.
Chair, you have 14 yeas, 0 nays, 0 passes. Senate Bill 867 is reported with recommendation.
Thank you, Madam Clerk. Next, we will vote out House Bills 906, 907, and 90H8, which we heard testimony on November 12th. Are there any questions? Seeing no questions. Not wishing to speak in support of the bill, Danielle Serrani from Michigan County Social Services Association. I will now take a motion from Representative Neeley to report Senate Bill 906. With recommendation, Madam Clerk, will you call the vote?
Chair Carter?
Yes.
Representatives Liberati?
Yes.
Neeley?
Yes.
Scott?
Yes.
Young?
Yes.
Grant?
Yes.
McFall?
Yes.
Snyder?
Yes.
Wilson?
Yes.
Mueller?
Yes.
Filler?
Yes.
Wenzel?
Yes.
Aragona? Beerline?
Yes.
Nyer.
Yes.
Mr. Chair, you have 14 yeas, 0 nays, 0 passes. Senate Bill 906 is reported with recommendation.
Thank you, Madam Clerk. I'll now take a motion to report Senate Bill 907 with recommendations from Representative Scott. Madam Clerk, will you call the vote?
Chair Carter?
Yes.
Representatives Liberati?
Yes.
Neeley?
Yes.
Scott?
Yes.
Young?
Yes.
Grant? McFall?
Yes.
Snyder?
Yes.
Wilson?
Yes.
Mueller?
Yes.
Filler?
Yes.
Wenzel?
Yes.
Aragona? Beerline?
Yes.
Nyer.
Yes.
Mr. Chair, you have 14 yeas, 0 nays, 0 passes. Senate Bill 907 is reported with recommendation.
Thank you, Madam Clerk. I'll now take a motion to report Senate Bill 908 out with recommendations from Representative Grant. Madam Clerk, will you call the vote?
Chair Carter?
Yes.
Representatives Liberati?
Yes.
Neeley?
Yes.
Scott?
Yes.
Young?
Yes.
Grant? McFall?
Yes.
Snyder?
Yes.
Wilson?
Yes.
Mueller?
Yes.
Filler?
Yes.
Wenzel?
Yes.
Aragona?
Yes.
Beerline?
Yes.
Nair.
Yes.
Chair, you have 15 yeas, 0 nays, 0 passes. Senate Bill 908 is reported with recommendation.
Thank you, Madam Clerk. I was all prepared to give a farewell and thank you for all the good time speech today. But we have some unfinished business, so we will go at ease.